Hello everyone, how are you all doing? Awesome. Type in the chat if you can see my screen. Awesome. All right. Hello, Charlotte. This session will be about an hour and 15 minutes, something like that. In fact, maybe I think it'll be about an hour. We'll try and keep it to an hour. How's everyone's day been? Excellent. Yeah, we've just started. Oh, happy birthday. Yes, we'll have questions at the end if you guys want. Okay, cool, everyone. So let's jump right into today's session. So today's session is going to be about the urinary system, which is another one of the fascinating systems that make up the human body. And basically, it's a system that produces, stores, and eliminates urine, and it's mainly to do with the kidneys. So in today's session, we're going to use Menti. So this is the Menti code for today. I'm going to post it in the chat as well, so you guys can access it. Okay, so I'll wait for you to sign up to Menti. Yes, Chinese, that's right. This is, I think, the last session. But we do hold this kind of sessions every week. Um, so you can sign up to that if you wish. We've been doing them for every Monday for the last 3 or 4 years. So that's an option if you want. Lacey, do you know how many questions there'll be in the quiz at the end? I actually don't know, but I think the questions will be based on what we cover in these sessions. Um, so yeah, I don't think there'll be that many. I think we did also do a session on YouTube as well. So some are free sessions, some are of subscription. Yeah, I think you're right, Aisha. There's 20 questions. Okay, perfect. So let's jump right into today's session. So today's learning objectives is we're going to look at the urinary system. We're going to learn about the anatomy, i.e. the structure of the urinary system, and then also what organs make it. And then we're going to look at some pathology that affects the urinary system. So first question for you guys on the Menti. So what are the functions of the urinary system? So Sufyan, the code is at the top. It's 15145253. Wow, so there's so many different answers, and I think you guys are very good. Well done. So you guys got a lot of right ones, but the kidney actually has a lot of functions. Well, the urinary system does. So The main function is it produces, stores, and eliminates urine. So this is composed of the kidneys, the ureters, the bladder, and the urethra. And actually, the kidneys have extra functions as well. So not only do they eliminate waste from the body, they also help regulate blood pressure. They regulate blood volume, also controls the levels of electrolytes and metabolites, and also regulates pH. So actually, the kidneys are very specialized organs, and they actually process an enormous amount of blood. So on average, an adult will produce around 2 liters of urine per day, but the kidney itself will process around 180 liters. So can you imagine? Most of the fluid is reabsorbed, but the kidneys basically filter through all of your bloodstream to make sure everything is well regulated. And there's in each kidney there's about 1 million filters. They're tiny filters called the nephrons. And what's very fascinating as well is that you have two kidneys, but one kidney can do 70% of the work if it needs to do. So that's why if you have one kidney that fails, you can actually live more or less um, a healthy life with only one kidney that's functioning. So that's very interesting too. So there's a lot of interesting things that the kidney does. So let's talk about the kidneys. So the kidneys are two bean-shaped organs, one on the left and one on the right, and they sit behind in the abdomen in an area called the retroperitoneal space. And they are 12 centimeters in length in adults, around that. And they receive blood from the renal artery, and they are drained via the renal vein. Shawnee says, Your voice is gone. Can you guys hear me? Oh no. I guess me asking the question means you probably can hear the question. Okay, cool, perfect. Alia says, No, oh, you can't hear me. Okay, fair enough. Um, okay, so the kidneys receive blood from the renal artery and are drained via the renal vein, and each kidney is attached to a ureter. This is a tube that carries the excreted urine to the bladder, and the bladder basically stores your urine. And then the bladder then via the urethra takes urine to the outside world. So this is basically the general anatomy of the urinary system. So what is the function of the kidney? So the kidney removes waste products from the body. It removes extra fluid. It helps with electrolyte balance, so it helps with the balance of things like sodium and potassium um, and other minerals. It also helps with acid balance. It helps control blood pressure via a very clever system because the kidneys actually communicate with other organs as well. So they communicate with the heart, and I'll show you how that works later. But essentially, the kidneys can control your blood pressure. They also make hormones that make red blood cells, and they activate vitamin D. So you can see there's a lot of functions that you might not necessarily associate with the kidneys, but the kidneys are very, very useful. So the main component of a kidney is called a nephron. So there's 1 million nephrons, around 1 million nephrons in each kidney. And this is basically composed of um, different parts. So the glomerulus is a cluster of tiny blood vessels, and they filter your blood. They have thin walls to allow smaller molecules to pass through, and they basically maintain large molecules. Kemi's saying, I can't hear anything and I've rejoined 5 times. Do you have headphones? Yeah. Oh, so I'm not sure um, what to do in that case. Let me just type in chat. Can you? Alia's saying, I think your laptop is broken. Okay. Um, yeah, I think it must be an audio issue. Tubules, and then there's also the tubule, which is the blood vessels that run along the blood vessels run along the tubule, and basically this is where stuff is reabsorbed. So there's two different components basically of a nephron, and basically the blood vessels run alongside this, and this is how the kidney works. And it works through this process called ultrafiltration. So now we move on to see how does the kidneys, how do they regulate blood pressure? So blood pressure is regulated via this very clever system called the renin-angiotensin system. Melody, don't worry. I'm going a little bit fast through this bit, but we're going to cover all of this again later. So don't worry about the last bit. I'll tell you when the important parts come, okay? Um, so this is basically showing how the kidneys regulate blood pressure. So the kidneys, they will detect a drop in blood pressure, and they will also detect a drop in volume. And the way they do this is they have these sensors and these nephrons. And basically, when that happens, the kidneys release this substance called renin. And renin basically helps convert angiotensinogen, which is made by the liver, to angiotensin 1. Then angiotensin 1 then circulates in the bloodstream, and then in the lungs, you actually have an enzyme called ACE, which is angiotensin converting enzyme, and that converts angiotensin 1 to the active form, which is called angiotensin 2. And then angiotensin 2 then goes back and acts on the blood vessels directly to vasoconstrict, and therefore it lowers it um, increases blood pressure. Also, it acts on the adrenal glands, which sit just above the kidneys, and the kidneys the adrenal gland will then release aldosterone, which then tells the kidney to reabsorb more fluid, and therefore the blood pressure goes up. So this is actually a very, very sophisticated system of how we can regulate blood pressure. And Grace, I know this is quite confusing, but this is one of the most confusing principles that we study in medicine, the way the kidneys regulate blood pressure, because there's a lot of things going on. And in medical school, we have to memorize all these different parts. But the reason, basically, the takeaway from this is that it's just a very, very beautifully regulated system. You don't need to memorize the ins and outs because it's not going to be relevant to you until you go to medical school and you want to study nephrology. But right now, the takeaway is basically that the kidneys regulate blood pressure, and they do this by communicating with all these different organs. So Nida's asking, how does it decrease blood pressure? So now that actually this system doesn't decrease blood pressure, it increases blood pressure. And that's why, does anyone know any drugs that we use that lower blood pressure? Anyone know of any drugs that I've heard of? So Dan is saying statins. A lot of people start saying statins. So statins actually lower cholesterol levels, but very close. Oh, well done, Edward. So Edward is saying ACE inhibitors. Anyone heard of this term called ACE inhibitors? Has anyone heard of an ACE inhibitor before? So what an ACE inhibitor does is it basically is a type of blood pressure medication. And actually someone posted in the chat one of them. So ramipril is a type of ACE inhibitor. And basically what an ACE inhibitor does is that it acts on this enzyme here called ACE, and it stops it from working. It inhibits this enzyme. So then what does that mean? If you inhibit ACE, then angiotensin 1 doesn't get converted to angiotensin 2. So then you don't get the other effects. Does that make sense? And so it acts on the system, but it's a very, very regulated system. It's very tightly regulated, and this is why the human body is so you need to find it's very finely tuned. Aisha saying, is this sympathetic? So this is not to do with the sympathetic or parasympathetic system. And yeah, this is a negative feedback loop. So aldosterone doesn't. How does how does aldosterone increase blood pressure? So aldosterone increases blood pressure by acting on the kidneys, and what it tells the kidneys is that it tells the kidneys to reabsorb more sodium and more water. So if you have more water in your body, the blood pressure is going to go up in your blood. Does that make sense? There's basically two ways you can increase blood pressure. The two ways are you either constrict the vessel so that there's the same amount of fluid but flowing through a smaller vessel, or you increase the amount of fluid, the volume inside. Does that make sense? This is like kind of like the principle of physics, like volume and pressure. Do you guys know the pressure equation? Yeah, well done. Exactly. So that's what it is. But so let me quickly recap this system because it is quite nice to know how it works. So let's recap. So essentially, your kidneys will detect there's a drop in blood pressure and there's a drop in blood fluid volume, okay, in the blood. So what the kidneys do, they release renin. Renin is released by the kidneys and it acts on angiotensinogen, which is something produced by the liver, and it basically converts that to angiotensin 1. Angiotensin 1 then flows in the bloodstream and gets converted by ACE, which is in your lungs, to angiotensin 2. Angiotensin 2 is the active form, and angiotensin 2 then goes and acts on the blood vessels to vasoconstrict them, making them narrower, therefore increasing blood pressure. And also, it also acts on adrenal gland to secrete aldosterone. Aldosterone then goes and acts on the kidney to tell the kidney to reabsorb more water and more sodium. And from then, the blood pressure rises as well. Isabel Hughes Rollins is saying, if you were losing blood and your kidneys detected this, then would this make the situation worse, or would the kidneys not release renin in this case? So what would happen then is, so this system is like running in the background all the time. But if in an emergency setting you're losing blood, then also activate another system as well. You activate your sympathetic drive as well, so that increases blood pressure as well. So that these systems all act in synergy, but your kidneys will also release more renin if you're bleeding, because it'll detect a drop in blood pressure. Aisha saying, when is angiotensinogen produced? So it's produced all the time by the liver. It's just produced in the background. It's just there circulating in your bloodstream. Does that make sense? Renin is an enzyme. Yes, that's right. Caitlin's saying, if someone was suffering from blood pressure issue, when would the kidneys be investigated? So usually you investigate them uh, or in your routine bloods. You check for kidney function. Malia is saying, how does water increase blood pressure? So the more water you reabsorb by the kidneys, they end up in the bloodstream. And therefore, if you have more volume in your bloodstream, that will increase your blood pressure. Does that make sense? Ellen, what's the simplified version of everything you said? So a simplified version is basically the kidneys regulate blood pressure. That's what you need to know. Okay, but the system itself is just complicated. This is one of the most complex feedback mechanisms in the whole body. But I'm just trying to demonstrate to you that the kidney is communicating with all these different organs. Does that make sense? And Tyler's saying, does this system link with ADH? Yes, it does. So ADH, antidiuretic hormone, is similar, but that's actually produced by um, your brain. So angiotensin 1 has no purpose, but the creation of angiotensin 2, um, so it gets converted to angiotensin 2. So it's like the inactive form, and then it needs to be activated. Does that make sense? Lena's asking, do we need to know this for the quiz? Um, good question. I don't think so. I don't think the quiz will be that mean. But essentially, takeaways are kidneys help regulate blood pressure. Then we'll look at the ureters. So ureters are tubes are made of smooth muscle that transport urine from the kidneys to the bladder, and they are around 20 to 30 centimeters long and 3 to 4 millimeters in diameter in adults. And basically, the urine flows in them through a process called peristalsis. Okay, so it's like it's the same way how food moves in your alimentary system, in your digestive system, is the same kind of way. Okay, so it moves through a system of peristalsis. So sequential contraction of the smooth muscle. And then we have the bladder. So the bladder is a hollow muscular organ that stores urine before it gets excreted, and it can hold around 300 to 500 milliliters of fluid before the urge to empty. And again, it also empties through a process called peristalsis. So it's basically this is what it looks like. Okay, and it's got different parts, like it's got the body, it's got the apex, which is at the top, it's got a neck and a funda. So these are just parts of the bladder. Okay, and it has these muscles here. So the detrusor muscle, the sphincters, the pelvic floor muscles, and they all help assist the bladder. Malia's saying, if I hold my urine for too long every day, what happens? So you'll get the urge to pee because the muscles sense that, but nothing really happens. But if you hold it in for too long, then potentially that some case studies have shown that it might increase the risk of infection and things because you're holding on to urine, but it's it's inconsequential. And then we have the urethra, which is a thin tube, again, similar to the ureters, and they basically transport urine from the bladder to the outside world. And just remember that in males, it's much longer. So a male urethra is 18 to 20 centimeters long, whereas a female one is 4 centimeters long. Um, and again, it has sphincters in place to make sure that urine doesn't leak. And basically, it empties through, it's controlled by your parasympathetic nervous system. Let's have a look. What is Sophie's question? Sophie's asking, is this structure different in men and women? So yes, the urethra is different. The bladder is very similar structure in males and females, but the urethra is different. The tube is much longer in males. And Mehreen's asking, isn't peristalsis also the method of transporting food to the esophagus? That's completely right. Well done. So it's the same mechanism. It's that rhythmic contraction of muscle that moves things along. Okay. Chloe, where's Chloe's question? I can't see Chloe's question. Okay. So let's move on. So now let's have a look at live anatomy of this. So let's have a look at what the structures look like. So let me know if you can see the screen right now. So it should show a model. Let me know if you can see it. Excellent. So let's have a look at the urinary system. The urinary system, remember, sits at the back. Okay. So it sits near the spine, paraspinal, okay, in the retroperitoneal space. And you can see the kidneys around. So we generally say the levels by what vertebral levels they are. So they stretch from basically L1, L2, L3. So can you guys see this is L1, L2, L3? It's around there. You can see the kidneys. Okay, and you can also see here, these are the ureters coming from each kidney. This is one ureter, this is the other ureter. So this one here is the right ureter, and this is the left ureter. And in fact, if I remove the digestive system, we'll be able to see them more clearly. And I'm going to also add the arterial and venous supply. And what you should notice is that let's start with arterial. So the arterial supply of the kidneys, can you guys see that the kidney gets its arterial supply directly from this artery here? This is the most major artery in your body. Anyone know what artery this is called? Yeah, well done. So this is called the aorta. Excellent. And you can see the kidneys, because they filter your whole bloodstream, they require blood supply directly from the aorta. Okay. And then they also drain right back into the largest vein in your body. Anyone know what this vein is called here? The largest vein in your body, sitting next to the aorta? Yeah, well done. So this is called the vena cava. But anyone know specifically what it's called? This is because there's two vena cavas actually. There's a vena cava at the bottom, and there's one going from the top. So what is this called here? Yeah, well done. So this is called the IVC, the inferior vena cava. Okay. And as we go down, the ureters go down, and then they drain into the bladder. So this structure here is called the bladder, and it's basically a muscular hollow organ where urine is stored, and then urine is then carried. So let me move the skeleton. Urine is then carried through the urethra to the outside wall, and you can see in males it's longer, whereas in females it's shorter. And in males you also have an enlarged gland here that sits besides the urethra. Anyone know what gland this is called here? That commonly, as you get older in males, it gets bigger, and sometimes you have cancer there. Yes, this is called the prostate gland. Excellent. Well done. Excellent. So that is the urinary system. So let's go back and let's do a case study now. And we can tackle the questions as well. So let me know if you can see my screen. Let's have a look. Can you see my screen? Perfect. So let's move on now. So let's have a look now at anatomy on a 3D scan, and then we'll do a case together. So let me unshare this. Can you guys see a scan now? Should show a scan. Excellent. So this type of scan is called a CT scan, but this is a non-contrast CT scan. Basically, what this means is that we don't use any dye. So when someone has a CT scan, generally what we do is we inject dye into their bloodstream, and then it basically lights up different blood vessels so you can see them bright. Okay. But in this kind of scan, we don't do that. So here you can't see any bright vessels. Okay. For example, if I show you this scan here, this scan, you can see the blood vessels are very bright. Can you guys see that? This vessel is bright. This is called a contrast scan. Okay, we've injected contrast. But if we don't inject contrast, then everything looks dark. Okay, apart from obviously bone, because bone is very dense. So bone is always going to look white on an X-ray, on a CT scan. CT scans use X-rays. So let's go through this X-ray together. Well, CT scan together. So if I keep scrolling down, first of all, right now we're looking at the top of the abdomen. So you can see this dome-shaped muscle here. It goes like this. Anyone know what dome-shaped muscle this is here? That separates the lungs from the abdomen? Diaphragm. Well done. That's a diaphragm. So as I keep scrolling down, we now see the top of the abdomen. So in top of the abdomen, we basically see three main organs. There's this organ here, which is the largest solid body organ in your body, the second largest organ in your body altogether, the liver. Well done. So this is your liver. Then next to your liver, we see this organ here, which basically connects to your esophagus. It contains some air. This is your stomach. We can kind of not really make it out that well here, but this is your stomach. And then on the left-hand side, we see the third organ that usually appears at the top of your abdomen. On the extreme left-hand side, this is to do with your immune system, also to do with your lymphatic system. Anyone know what organ this is here? Not the pancreas. The pancreas is here, actually. This is your pancreas. What organ is this? Yes, well done. This is your spleen. So remember, whenever you see a CT scan, right at the top, you should see the liver, so LI, then the stomach, ST, and then the spleen as well, SP. Okay? And then if you keep scrolling down, then we start to see other organs appear. So now we see the pancreas. So this organ here, can you guys see it's a feather-shaped organ like this? This is the pancreas. Okay? And then we then start to see these two organs appear. So if I keep scrolling down, what organ are these? This organ and this organ. What are they? Well done. So these are your kidneys. Can you guys see kidneys here? This is the right kidney. This is the left kidney. And let me go down. What's the dark area above the pancreas? You mean this one? That's your stomach. It contains air. Anything that's really dark on a CT scan basically means it contains air, and that's your stomach. It's got your stomach gas bubble, and your intestines are here. They contain air as well. Okay, so these are your kidneys. Now, can you guys see above a kidney? So above this left kidney, there's this triangular shaped, kind of star shaped thing here. Can you guys see this? Anyone know what organ this is here? This is a very tough question, but anyone know this is it's very small triangular shaped. What organ is that? Well done. So this is the adrenal gland. So do you remember the kidneys have a small hat on them, a small cap called the adrenal gland? So this is the adrenal gland. So and actually on the other side, um, on the right side, you can see it here. This is tiny, tiny um organ above the kidneys, and you're right, they produce hormones. Anyone know what hormone the adrenal gland produces? It produces a lot of hormones, but anyone know a main one that it produces? Yes, well done, adrenaline. Okay, excellent. And someone said gallbladder. So does anyone know where the gallbladder sits? Where is the gallbladder? Yes, next to the liver, under the liver. So this actually, can you guys see this here? That's your gallbladder. This is your liver. This is your gallbladder. Can you guys see it? Gallbladder? Excellent. Now, as I keep scrolling down, then we see this tube coming out the kidneys. What tube is that? Coming out the kidneys? Ureter, well done. And if you follow the ureter, we follow it down. What does it go into? What is this here? That's your bladder. Excellent. Well done. Very well done. Cool. So this is, we're looking at a scan here. This is what a non-cut shot scan looks like. And you're right. This is actually, so interpreting this kind of scan is quite tricky. So don't worry if right now you're looking at this thinking this is really confusing. Don't worry, because it is confusing. This basically requires a radiologist to interpret this, which is a specialized doctor. Okay, so don't worry if you're looking that it looks a bit difficult to understand. Why is everything moving like that? It's because basically to interpret this kind of scan, you want to scan through it like this. You want to see all the different organs. Um, so when I was working in hospital, some of the senior radiologists, the way they'd look at a scan is literally they'd scan like this and they'd know exactly what was going on. Like within 2 minutes, they'd know, okay, this patient has X, Y, Z. They'll be so quick at interpreting this kind of scan. Okay. But right now we're just starting off, so we're not going to be on that level. Um, by the way, let's test some more while we're here. We might as well learn some more anatomy. So anyone know what this is here? Yeah, well done. This is your vertebrae. Excellent. What about this bone here and this bone here? They're coming off the vertebrae. Ribs. Excellent. Well done. That's the ribs. What is inside? What's protected by your vertebrae? What's this inside? So protected by your spine. Sorry, not by your vertebrae. Sorry, not by your ribs. Your spinal cord. Yeah, excellent. Well done. Your spinal cord is here. Very good. Then what is, if I scroll down, this is going to be a tough question, okay? But I want you to try and deduce the answer. So you can see that different structures have different shade on the CT scan. So for example, this shade here is what skin, subcutaneous fat and skin looks like, okay? So this is skin, this is subcutaneous. Underneath that, what we see is these two here lining the abdomen. Anyone know what these structures are here? Well done, Shanice. Well done, Tudor. So this is actually muscle. This is called, anyone know what this muscle is called here? Right at the front of your abdomen. This is your ab muscle. Excellent. Did anyone know the technical term for them? The abdominals, yeah, rectus abdominals. That's what the answer is. Excellent. Well done. So these are the rectus abdominis muscles. So now, same kind of logic. Anyone know what muscle this is here on either side? Yes, well done. These are your gluteus maximus. Excellent. Well done. And then these muscles, these muscles here are called the paraspinal muscles because they're next to your spine. Okay. And you can see the lateral obliques as well. Okay, so we're just going through various structures. Don't worry if you're confused because this is quite confusing. Okay. Yeah, I'm not expecting you to know this because this actually requires a level, not even of just a medical student or a medical graduate, it actually is a level of a specialist. So this is why, hence, this is quite confusing, but it's just a gauge your knowledge, just to see if you can figure out some things. And you're right, Aisha, the bones do look like they're glowing. The reason is because bones are mineralized and therefore they absorb all the X-ray energy and therefore they look very dense on a CT scan. I think the photos are basically like salami slices of a person. Yes, exactly. That's a good way of thinking about it. So every image is basically one slice of a patient's body, and the computer basically puts all these images together. And what's very nice about CT scans is that because it's a 3D image, you can restructure it so you can see it in a different view as well. So, for example, we can see it in this view as well because it's a computerized image. So this kind of image is called a coronal image, and this kind of image is called an axial image, but you can change it around. And you can do 3D view as well, but it requires special software. Okay. So what we're going to do actually is we're going to try and, based on our limited knowledge of a CT scan, we're going to try and solve some cases together. And I think you guys will do very well. I'm very impressed so far. So I think you guys can do it. So the first case is a 56-year-old man who presents to the emergency department, the ED, with severe pain in his right side. Okay, so this is our first case. So over to you guys. What questions would you like to ask? He was saying, what's ED? ED is the emergency department. A&E. So this is a patient who's coming to your clinic, and what questions would you like to ask them? Yeah, so this is the case. I'm trying to make this case as realistic as possible because in real life, this is how patients will present. You actually would not know that much detail about a patient when they come to you, and then you investigate everything further. Does that make sense? So this is what you've been told, and then it's your job to now try and ask some questions, try and figure out what could be going on. Okay, so I'll give you a few minutes to come up with some questions. Excellent. So some really good questions here. I like how some people start with open-ended questions like, how are you feeling? Very good. And then we'll move on to Socrates. Yeah, so don't worry if it seems confusing to you. It's completely normal. When I was at your stage, I had no idea about any of this. So it's just trying to understand the basics because I don't expect you to know any of this. So we're just asking a few questions to the patient to try and find out what could be going on. So this is what we find out. We find out that the patient woke up this morning with sharp pain in his back and side. He also notices some blood in his urine. He has no medical history, so that means he's got no previous medical problems. And when you examine the patient, he's withering in pain. He's in a lot of pain. So, what investigations would you like to request? So, now you want to deduce what's causing the pain, right? So, what do you want to test now? So, you're ordering some really nice tests. So, some people are saying a blood test, a urine test, a CT scan, excellent. Very good. So, we do a urine test because the patient says he's seen blood in the urine. So, we want to confirm that. And this is how urine test is done, by the way. So, we ask the patient to pee in a cup and then we dip this in you dip the urine in this, and then you can see based on interpreting this strip what they have. It's like a litmus paper test. Yes, well done, Yasma. So it's similar to that. In fact, it's a similar kind of technology that we use, and it also can sense pH level as well. So it's this is what we call a urine dip test. So this is a urine analysis, and then we also order a CT scan, and what we're trying to look for now is what could be causing the patient's pain. And what we do is we do a CT scan and we find an abnormality. And you guys are very, very good. Well done. So the majority of you have picked up that there's a huge ball right next to the kidney. Anyone know what kidney this is here? What side is this on? Yes, excellent. So it's um what's what's actually um what's actually I think this is meant to be like a trick question, but essentially the patient reported that the pain was on the right hand side. The stone is actually on the left hand side. It oftentimes happens, by the way, that you mix up left and right, or the history is not done correctly, and you end up doing an investigation. You find out the problem is on the other side. So actually, in this patient, what we find there's a kidney there. There's a kidney stone there on the left hand side, and it's actually quite a big stone. In fact, let me show you guys. I'll show you guys more CT scans in a second, but let's talk about kidney stones while we're here. So basically, what this patient had was he had kidney stones. Surujay is asking, is the CT scan in the wrong direction? No, so the CT scan is in the right direction, but the patient themselves reported the pain on the wrong side. But on examination, when you examined, they felt pain on the left hand side. It's a bit confusing. But what causes stones? So stones are caused by hard deposits made of minerals and salts that form inside your kidneys. And there are many risk factors that will cause you to develop stones. So, for example, dehydration, having a high BMI. Anyone know what BMI stands for? Body mass index, well done. So body mass index. So basically obesity, if you have a very high BMI, so for example, obesity, then that is a risk factor for the developing renal stones. Also, certain types of medication supplements can also increase the risk. And also having family history or any personal history will also predispose you to developing stones. And this is what a stone looks like. So can you guys see? I know you guys have done gallstones in the previous session, but these are what kidney stones look like. Can you guys see this is what a kidney looks like? And can you guys see this bit here? This is a very special type of stone called a staghorn calculus because it looks like a staghorn. And this is actually one of the most painful conditions to exist in the human body. Someone with kidney stones reports a 10 out of 10 pain. It's insanely painful. Because can you imagine the kidney is trying to push urine through this where the stone is blocking it, so therefore it just becomes really, really congested, and it could lead to kidney scarring and eventually kidney failure. So the stone forms over time because the minerals crystallize. So these are formed by all these minerals building up and crystallizing. That's a very good question, Eknor. How does it become so big? So if it essentially starts off small and then it keeps getting deposited and then it just becomes bigger and bigger and then it causes overwhelming pain. So what are renal stone symptoms? So severe sharp pain, and usually the pain is a shooting pain from your loin to your groin. So from the top of your abdomen to the bottom to your groin. So it's really sharp pain because your kidneys, remember your kidneys are connected to your ureters that they try and push urine via peristalsis. So anytime ureters try and contract via peristalsis, you get severe pain. And you also get pink or red urine. You get nausea and vomiting, and also fevers and chills. Um, so, what is the treatment of this? So, the treatment is to do a CT scan, to give some very powerful painkiller medication because it's one of the worst types of pains you can ever get. And if it's less than 10 millimeters, you do what we call medical management. So, essentially, what we do is we wait for the stone to pass by itself because it's considered a smaller stone. But if it doesn't pass, and we either do shockwave lithotripsy, which is very powerful lasers that break down these stones, or we do surgical removal of the stone. I can show you guys what the laser therapy looks like in a second. Um, but yeah, it's very It needs urgent treatment because it's very, very painful. Um, Maya's asking, or who is it? Someone's asking, Elias asking, can't you just remove the kidney? So that would be not very ideal because I know you can survive on just one kidney, but you'll then if you have kidney stones in your other kidney, then that's a very bad um, outcome. So you generally want to preserve the kidneys as much as possible. Joshua was asking a very good question. How do you work out the diameter? So the way you work it out is actually on a CT scan, you can measure. So you measure it through the CT scan, and that's how you know. Okay, let's have a look now at the quiz. Well, let me go back actually. I'm going to show you now what laser therapy looks like. So hold on. Are you guys okay with seeing gruesome stuff, by the way? Okay, give me a second. I'm going to load it up. Okay. So you guys okay with seeing it? Perfect. Okay, so let me show you guys. For some reason, the screen's not sharing. 1 second. Okay, we should be able to see it now. Can you guys see my screen? This should be a YouTube video. Perfect. Let's go through this together. So what we're doing here is we're putting a camera, um, which is called a uteroscope, into the ureters. So we're feeding it into this is a camera here, and we're feeding it into the patient's body. So you can see here, this is how the camera is operated by the surgeon, and this is a camera view. Okay, so we're seeing the ureter here, and what we're doing is we keep pushing it in until we get to the place where the kidneys are. So we're going through the ureters here. We can see not to, so here we're going through the ureter, going through the cameras, and then you can see on the camera now. Now we start to see the stones. Can you guys see the stone here? These are the stones. This is a ureter. You can see the stone is sitting there. Now, what we try and do, we're now hitting the stones with some really powerful lasers. Can you guys see that the surgeon's operating using his hand? He's shooting the stone with really powerful lasers, and then he's breaking down the stones. And then what we're going to do is we're going to try and wash the stones away. So the fragments are then washed down, and we can extract them. So what happens actually? Some surgeons they would. It's kind of like in a way, kind of like playing a game. Like you're basically trying to catch as many stones as possible. So here the surgeon is breaking down the stones, and then he'll go and collect them, or some of them will just be washed down anyway. So you can see some are washing away. Some you'll have to go and collect them. Francis is asking, what happens if laser shoots a kidney wall? So that's the thing, it's very targeted.
The energy setting is based on the needed effect, in this case, stone fragmentation, and the resulting effect of the laser energy on each specific stone and location in the urinary tract. In this case, 10 hertz and zero point 0.6 joules are used.
So yeah, the patient is asleep right now. He's under anesthesia. Anesthesia is asking, where do you go in from during surgery? So this surgery is done through the urethra, and you go into the bladder, and then from the bladder you go into the ureters. So you literally go up the whole system using the camera is basically like a very long tube. Yeah, this is well, it's not as invasive as having a full-blown operation, but it's still you're basically inserting an instrument into the human body. So yes, it's invasive, but not as invasive as doing an open operation. And this kidney stone is huge, yes. Don't forget the camera is magnified, by the way. So in fact, we'll see how big the kidney stone in a second because the surgeon will then pick them out.
The flow by using the manual irrigation
And then, so the surgeon's now cleared out all the stones. And then
of the dome.
you'll see is the surgeon will put the stones into a pathology jar. So we'll see how big the stones are. So where are they? Let's see. The surgeon's picking them out.
Use.
You'll see how big they are when they take them out. 1 second.
We use a tipless nitinol bone fragments. This is always under
There, look, the surgeon's picking out the stone, and you'll see how big it is in a second. Carefully maneuvering out. The surgeon's making it look really easy, but it's actually very difficult, by the way. So you can see now, we can see how big the stone is. Can you guys see how big the stone is? It's tiny, but this tiny stone is causing immense pain, like 10 out of 10 pain. Yeah, I know. You guys are very underwhelmed, right? That tiny stone was causing so much pain to this patient. But
evaluated once extracted. The stones are sent for stone
on the
analysis.
camera, it obviously looks huge because this is the whole point of using a camera. I mean, so by the way, this was a fragment of the stone. So maybe the stone was bigger than this. But don't forget, 10 millimeters isn't actually that big. 1 centimeter. That's the size requirement for them to cause a lot of pain, for them to be considered large. Remember? So that's it. So, and now we can see we'll inject some dye into the ureters, making sure they're fine, and we're clear. So sometimes if the patient has problems with their ureters, we sometimes put a stent there to keep the ureters open. But in this case, we didn't do that. It doesn't take very long, it takes about 30 minutes. So let's quickly do a quiz now, and then we're going to do a CT scan quiz as well. So let's go. Let's do the first question here. Nephron, well done. You guys are smashing it. Very good. Next question. So what's the investigation of choice for CT for renal stones? Kind of gave the answer away. Non-contrast CT. Excellent. Well done. Next question. Yeah, I flopped that one. Sorry about that. Well, so what is the length of male urethra? This one's a tough one. Let's see. Do you guys remember? Come on. Well done. 18 to 20 centimeters. Very well done, everyone. Now, next one. Now, based on that, we know that based on the previous question, who is more likely to suffer from urinary tract infection and why? So the answer is females. Because the urethra is shorter, the the um the bacteria sitting in the outside world are closer to the bladder. Does that make sense? So therefore, you're more likely to develop urinary tract infections. So in general, females are more likely to develop urinary tract infections. Males are more likely to develop kidney stones, on the other hand. Let's have a look at the leadership board. Well done, everyone, but Mehreen was at the top today. But we have another quiz, by the way. So now we have the stone quiz. So let's actually have a look at the scan. So this is a tough one, okay? But let me show you guys the scan. So let me share my screen. So this is a scan you guys are seeing. Now, the stone, if you look very closely, it's actually here. This is a stone, okay? You can see, by the way, that this is the left kidney, this is the right kidney, but the right kidney doesn't look normal here. Can you guys see the right kidney compared to the left? What do you guys notice? This is the right kidney, this is the left. What do you guys notice between these two kidneys? Yeah, it's bigger, excellent, and it just looks. Would you guys agree it looks inflamed? Can you guys see this is, and you can see around it there's fat stranding, which is a sign of inflammation. So right kidney is bigger. So what's happening here is that this stone here, there's a stone which is here. It's blocked the ureter, and as a consequence of that, the right kidney has become enlarged because the right kidney is full of urine. Does that make sense? Because there's blockage. That's what happens. So whenever you're trying to find a stone, always look at which kidney looks enlarged because that gives you a clue as to where the stone is. Okay, so that the stone was here. Right, let's go to the next question. Let's see where the stone is. So next question, where do you guys think the stone is? Wow, okay, you guys are very good. Well done. So most of you got it. So the stone is right there on the right-hand side again. So let's have a look at that one. So you can see the stone is here. That's the stone. And if we look at the scan again, you can see the right kidney is much bigger than the left kidney. To be fair, in this one it's more subtle, but you can still see it's bigger. Can I see that? So that's another stone, right kidney stone. Right. Let's do the next one. Next case. Where is the stone here? This is a different type of stone. This is not in the ureter this time. Where is the stone this time? The urethra. Well done, Aisha. So this is actually a urethral stone. So the patient's about to pass this. Does that make sense? It's about to go. And now this patient is actually has a genetic disease and it predisposes them to develop very, very large stones. So this is this one. You can see both kidneys have huge stones here. In fact, this patient's actually on dialysis. Both kidneys are not really functioning very well because they're fully scarred. They got huge stones. So this patient's actually on dialysis, which is like kidney replacement. Okay. And then I can show you something else as well. This is a bonus question. So this patient had some pain, and then we did a CT scan on them, and they have something called a normal variant. Can anyone see what the normal variant that this patient has? So the thing is, what's fascinating about the human body is that we study anatomy, but actually everyone is different. Everyone has variations of normal. This patient has a normal variant. Can anyone see what the normal variant is? This is the captured scan. What's going on here? I want you to pay close attention to the kidneys. So this is the right kidney. This is the left kidney. And if you follow it down, what happens? Well done. So this is the kidneys are merging. So this is called a horseshoe kidney. It's a normal variant, okay? But patients who have horseshoe kidneys, they are more predisposed to developing kidney stones, okay? But this happens basically because when the kidneys are growing in the embryo, they migrate upwards, and in this patient, they didn't. Their lower poles are merged. Okay, this is a normal variant. Okay, this is like so everyone is special basically. People sometimes don't even know they have normal variants, and then they have a scan and they find out they're different. Does that make sense? So this is called a normal variant. It's the horseshoe kidney. Okay, and then this disease we already looked at in a previous session. This is called polycystic kidney disease. Can you guys see that? The kidneys are really enlarged. Okay, and the last thing I wanted to show you from this session is I wanted to show you, so this is what polycystic kidneys look like. Can you guys see all these cysts here? The last thing I wanted to show you is something called robotic surgery. Have you guys heard of robotic surgery? So, um, a common way that we operate on kidneys is by the use of robots. Okay, so we use robots and this is like a developing field. And basically, this is what the robot looks like. So, can you guys see the surgeon here is sitting in a console and they're operating a robot on the other side of the
Hi,
room?
this is Jim.
Or the robot could even be in a different city or location. Okay, so this case, what we're seeing a female patient who has a mass in their right kidney. So let me show you the scan. So this is what the scan looks like. Can you guys see this is the CT scan? And if you look at the kidney, now to be fair, now that um, we've looked at different scans, maybe you can able to see the mass. So can you guys see that this patient, the left kidney is normal, the right kidney has inside it has a mass. Can you guys see that this is suspicious of being a cancer? Can you guys see this is not normal? The right kidney doesn't look normal. It looks kind of, it wouldn't be accurate to say inflamed, but it just looks not normal. Does that make sense? It's like rounded, it's a mass there. Okay. Um, so this mass we need to investigate further. So what the surgeon's going to do is they're going to remove this mass and then we're going to send it for histology
The
because it
axial
could be a
cuspert, and you
cancer.
can see
In
the
fact,
mass on the right
it's very
side.
likely actually to be a cancer. Can you guys see the mass here? It was the ceiling. Can you guys see the mass here? This is the
You'll cut
mass. Okay.
first,
So the surgeon is going to try and remove the mass. And
using the Da Vinci X.
when you start the surgery, you put in all these different ports. So the surgery is done the same way you do a laparoscopic operation. So you use all these cameras, all these ports, but this is all now controlled by the robot. Okay, and the surgeon is then controlling the robot in the console. So you can see these are the ports, and then now we get to see
Dividing it towards the posterior
what the operating
portion.
looks
And you
like.
can see it's like opening up a vena
So
cava.
this is a surgeon operating with the robot. And by the way, do you notice, by the way, the movement of the robot? It's very
There's the
accurate.
ureter, which is our landmark, and then the
You
renal.
notice basically that there's no lag. It's very accurate, and the movement is very smooth. That's the idea of the robot, because the robot is basically meant to um, try and aid the surgeon to operate as effectively as possible. And Marcus, so it's not accurate to say we're being replaced because the robot is fully controlled by a human. It doesn't have any intelligence. Does that make sense? It's basically just doing the surgeon's movements, but in a way that's very precise. Does that make sense? Because what it allows you to do is, for example, we saw how big the stone was. Did you guys see the stone looked huge on the camera, but actually when you take it out, it actually looks tiny. So what this robot allows us to do is allows the surgeon to have a really good vision of the whole structures, and the instruments are very tiny, and they can use the tiny instruments to operate. Does that make sense? Because if someone was to do this operation open, then imagine holding a very tiny scalpel. It'd be very difficult to operate like that. So this is like basically a magnified view. That's why robots are so useful, but they're fully controlled by humans. This isn't an AI or an autonomous like instrument doing it by itself. This is a human
Fourth
controlling it.
robotic arm, we're holding the kidney up.
And I think we're a very long way away of having robots actually do like actually being autonomous and controlling this, because this is actually a very high pressure scenario here.
And then that allows us to have stretch on the hilum, which gives us excellent.
So here the surgeon is
access to
dissecting carefully,
where that cut is. And you can see the mass coming into view here.
and we can
And
see
you
the
can
mass
see
here.
retroperitoneally. I think this was a good, we'd like to preserve this, the mass branch. We're again,
The
I really
surgeon's
think
cutting into the mass.
another branch there, which we've divided. I'm making a radionephrotomy sinus of the tumor, sharp dissection. So you can see the mass
The
becoming
surgeon's
more
carefully
mobile.
cutting the mass away.
And we can see that we're basically freeing up the final attachments. You can see we have a pretty large hole in the collecting system there, which we're going to oversew. I think in this case, it's very hard early on clamp to look at my defect. So I'm going to come off one artery first and see how much bleeding we have coming off early. Ligation here in order to secure any residual vessels that might be bleeding. I do use a Surgicel within the defect.
Can you guys see the gap in the kidney now? The mass has been removed. Can you guys see that? That's the mass being removed. And that's what robotic surgery looks like. Excellent. So, guys, that brings us to the end of today's session. Do you guys have any questions? Let's have a look at the Q&A. Yeah, so I think some questions about what we cover. So we cover all types of diseases. We cover autoimmune diseases, we cover different body systems, different pathologies. We cover a lot of things. In the chat, Freya is asking, what is peristalsis? So peristalsis is the rhythmic contraction of the smooth muscle so that food or urine passes through the ureters or through the esophagus, for example, it just means one bit contracts and the other bit contracts, so things pass by it. It's almost like how a snake moves. Do you know? Edna's asking, how did the stone cause the pain? So the stone causes the pain because your ureters are contracting against the stone, and so it causes a lot of pain. It's that pressure feeling, and then also don't forget your kidneys get bloated, so you get urinary retention, and then it becomes really painful. Jaden's asking, there's a weekly Monday session. Can you join? Yes, you can join. I'm actually not sure what the pricing is. It's organized by Premed Projects. I think if you email them, I think they do also have bursaries and things like that. So if you like to join that, then let them know. But it's basically done by like myself and Dr. Mustafa. We run it every week. Um, but it's organized by Premed Projects. What other questions are there? Is robotic surgery its own field of medicine? So no, Alan. So robotic surgery is a form of doing surgery. So basically, what will happen is you'll be like a renal specialist. So for example, you'll be a urologist, and then you will also do robotic surgery. Does that make sense? Or you'll be a neurosurgeon who does robotic surgery, or you'll be an orthopedic surgeon who does robotic surgery. So it's like a form, it's a way of doing an operation. It doesn't have its own specialty. Different specialties use robots differently. Can kidney stones be fatal? Dora's asking. So it's very unlikely to be fatal. Having said that, uh, if you have very severe urinary retention, the urine, um, your kidneys, sometimes they can even burst because of the pressure. Then you might end up having urinary sepsis and you might dying from that. So yeah, it can be fatal, but it's unlikely because the pain is so severe. You'd have so much pain before you would end up it being fatal. Um, it wouldn't be something that you wouldn't notice. Does that make sense? It's not like a silent killer. Like it's like not like a heart attack where you can die from a heart attack without knowing necessarily you had a heart attack. Does that make sense? Um, Vera's asking, can renal stones not be removed like how we remove gallstones by burning them? Um, so this is actually this kind of similar way. We use lithotripsy, so it's the same kind of way, but usually we do it with a camera. Let's have a look at the Q&A. Hibber's asking, if we get bad results on a test, can you retake? Yes, I think there is that option. So don't worry. I think you guys are panicking a lot by this test, by the way. It's no pressure. I don't think it's made to like trick you or anything. So don't worry too much about it. What is the final treatment for our case study? Did we go into surgery or let it pass by another method? So with this one, we did an operation to remove the stones. Lena's asking, is this the last session? I think so, yes, for the group sessions, I think. But we have sessions every Monday. So next Monday there's a session. What websites do you show to use scans? So these scans are used for research purposes, and they're from consented patients, and it's called Radiopedia. It's a very good resource. Okay, I would highly recommend going on Radiopedia. Very nice resource. How does the surgeon get into the kidney? So you saw by using the various instruments, the laparoscopes, the cameras. That's how we do it. That was already answered. Found treatment. Do you need maths A level for medicine? Roman's asking. No, we don't. Don't worry. You need chemistry and biology, but not necessarily maths. So I was a radiologist. Now I work in the pharma world, the corporate. Shanice asking, did you go to Imperial College? Yes, I did. I went to Imperial College. Same as Muzzy. We were in the same year together, actually, and we were best friends in medical school. So some of these questions are the same questions we had before. Do renal stones grow back, or are they good? Oh, they're gone. So that's the thing. If you still have risk factors for renal stones, then you might get them again. That's the problem. So there's a chance of recurrence. How much maths do you need as a surgeon? You probably don't need any maths, to be honest, as a surgeon. How long does it take to become a surgeon? So in the UK, it takes about, after medical school, about 8 to 10 years, I would say, to become a specialist. Hasiba was thinking, what's good to do as a third A level? So I would recommend anything you're interested in that you think you'll get a good score in, I would recommend doing. Niall is asking from yesterday's lesson, can you talk about what part of the brain is related with psychology of a person and what causes hallucination and what role the brain plays in that? That's a very tough question because we don't actually know that much about the brain, but we know that different parts largely do different things. So we know, for example, that the front part of your brain, the frontal lobe, it's responsible for your personality and executive decision making. So we know that people who have strokes, like problems or lack of blood supply to the frontal lobe, their personality changes. So we know that through that we can deduce that the frontal lobe is what makes your personality. But then all the other lobes also have an effect. So I can't tell you one specific area of the brain that was responsible. There's just many different places that work together. Yeah, A-level psychology is a good one. What is the radiologist called that scans a baby in the womb? So that's usually done by an OBGYN doctor, obstetrics and gynecology. It's not usually done by a radiologist. So the session's basically finished now. There's I hope you guys found it useful, but let me know how you guys get along. If you have any questions in the future, please feel free to get in touch with us. I'm more than happy to help you. But yeah, I hope you guys enjoyed this session. I know some of the concepts were very complicated. Okay, I know that because this isn't stuff that you would know in school. This is stuff that's like above school level. So that's why some of these concepts were very difficult to understand. Like the renin-angiotensin system is one of the most complicated systems in the human body. Okay, so I'm very actually proud of you guys for being able to even like understand the concept of it. And I'm very impressed by how you guys were able to look at CT scans as well. So very well done. And please continue to work hard. You guys are doing awesome. And I wish you guys all the best in the future. And yeah, I'm sure we'll do more sessions like this in the future. So hopefully you guys will sign up. And yeah, have a great evening. And I'll speak to you all soon, hopefully. Bye, everyone.